If you are a Canadian senior managing diabetes, what I am about to tell you could save you more than $1,000 every single year. Starting in 2026, insulin is free, metformin is free. And for seniors in certain provinces, even the devices you use to manage your condition are now fully covered. No deductibles, no co-payments, no dispensing fees, $0 at the pharmacy counter. This is not a rumor. This is federal law. And today, we are going to walk through exactly what it means for you, how to access it, and the mistakes you need to avoid so you do not accidentally pay for something you are now entitled to receive at no cost. Let us start at the beginning. Canada's healthcare landscape just went through its biggest expansion since Medicare was first introduced. In late 2024, the federal government passed Bill C-64, the Pharmacare Act. This legislation begins a structural shift toward a universal single-payer model for essential medications. The first phase of this program focuses on two categories. The first is contraception. The second, and the one we are focused on today, is diabetes medications. As of March 1st of 2026, this transition moved from legislative theory to clinical reality for seniors in participating provinces. If you live in British Columbia, Manitoba, or Prince Edward Island, your pharmacy experience may have already changed. And if you have not yet taken advantage of it, today's video will show you exactly how. Let us first understand the foundational principle behind this entire program. It is called first dollar coverage, and it is worth taking a moment to really understand what that means. First dollar coverage means the government's coverage kicks in on the very first dollar you spend. There is no spending threshold you have to hit first. You do not pay anything up front and get reimbursed later. You simply walk up to the pharmacy counter, present your provincial health card, and the covered medication is free. No deductible, no co-payment, no dispensing fee. The dispensing fee point matters more than many people realize. Dispensing fees are the professional charges pharmacists apply each time they fill a prescription. Even on a cheap generic medication, a dispensing fee can add $10 to $15 per fill. Under the new National Pharmacare program, those fees are covered too for medications on the approved list. This program is administered through the newly established Canadian Drug Agency. The agency is responsible for developing a national formulary, which is the official list of covered medications, and for negotiating bulk purchasing on behalf of the entire country. The goal is to use the federal government's collective bargaining power to drive medication prices down for everyone. Now, let us look at how each participating province has implemented this. British Columbia launched its national pharmacare coverage through a program called Plan NP, which stands for National Pharmacare. The launch date was March 1st of 2026. If you are a BC resident enrolled in the Medical Services Plan, coverage applies automatically at the pharmacy. You do not need to register separately or fill out additional forms. Your pharmacist looks up your MSP enrollment, and the covered medication is processed at zero cost. But British Columbia went a step further. Starting April 1st of 2026, Plan NP expanded to include coverage for certain diabetes-related devices and supplies. This includes continuous glucose monitors, sometimes called CGMs, and insulin pumps. If you currently pay out of pocket for a continuous glucose monitor in BC, mark April 1st on your calendar. Starting that date, coverage moves to the fully universal model. Many BC seniors do not yet know this device expansion is coming. If that is you, speak with your healthcare provider in late March of 2026. Make sure your records are updated so your coverage kicks in automatically on day one. Manitoba was actually the first province in Canada to sign a Pharmacare agreement with the federal government. That agreement was signed on February 27th of 2025. Coverage for the majority of diabetes and contraceptive products began in June of 2025. Then, on March 1st of 2026, Manitoba updated its drug benefits formulary through a bulletin called Bulletin Number 145. This update added additional items to the no-cost list, bringing Manitoba fully into alignment with the federal universal single-payer standards. If you are a Manitoba senior who has been on diabetes medications for a while, it is worth checking with your pharmacist whether any of your current prescriptions have moved to the no-cost list since last year. The formulary update may have added coverage you have not yet claimed. Prince Edward Island was among the very first to act. PEI launched its national Pharmacare program on May 1st of 2025. One of PEI's standout features was the early inclusion of blood glucose test strips for islanders taking non-insulin diabetes medications. Previously, those test strips required significant co-payments. Under the new program, they are covered. To access coverage in PEI, you need a valid PEI health card, and your medications must be dispensed at a participating PEI community pharmacy. If you are not sure whether your pharmacy participates, ask them directly. Most community pharmacies in PEI are already on board. Now let us talk about exactly which medications are free. This is the heart of what many seniors want to know. Insulin is covered. This includes several common insulin products such as Humulin R, Novolin GE Toronto, Basaglar, Semglee, Admelog, Trirapi, Kirsty, and Apidra. If you are currently paying for insulin in BC, Manitoba, or PEI, you should be paying nothing. The estimated annual savings for insulin coverage range from $900 to $1,700 depending on the type and dosage. Metformin is covered. This includes both standard and extended-release versions of metformin. Metformin is the most commonly prescribed first-line medication for type 2 diabetes. The annual savings on metformin are more modest, estimated at approximately $100, but it is still money that should stay in your pocket. SGLT2 inhibitors are also on the covered list. SGLT2 inhibitors, or sodium glucose cotransporter 2 inhibitors, are a newer class of diabetes medication. Common examples include empagliflozin, which is sold under the brand name Jardiance, and dapagliflozin, sold under the brand name Farxiga. These medications can cost significantly more than older drugs. Annual savings for this class range from $100 to over $1,000 depending on the specific medication and dosage. Sulfonylurias are covered as well. This class includes gliclazide and glyburide, two older but widely used diabetes medications. Annual savings here range from $100 to $500. Now here is an important medication that is not on the covered list, and many seniors are asking about it. Ozempic is not covered under the National Pharmacare program. Ozempic belongs to a class of medications called GLP-1 receptor agonists. While it is used to manage type 2 diabetes, it is not currently included on the National Universal List under Bill C-64. Wegovy, which is a higher dose version of the same active ingredient used for weight management, is also excluded. If you are a BC senior who requires Ozempic, there is still a path to partial coverage. You may be able to access it through Fair Pharmacare, which is BC's income-based drug coverage program, provided you have met your income-based deductible for the year and received special authority approval from your doctor. Special authority is a formal process where your physician submits clinical documentation to justify coverage for a specific drug. The GLP-1 exclusion is one of the most significant limitations of the 2026 rollout. It is worth monitoring the national formulary closely as it is expected to expand in 2027. Now let us talk about the strategies that will help you get the most out of this program. The first strategy involves what the program calls low-cost alternatives pricing, sometimes referred to as LCA pricing. The National Pharmacare program is built around generic first principles. If you are currently taking a brand name version of a covered medication and an equally effective generic version exists, the program will only pay the price of the generic. If you choose to stay on the brand name version, you may be responsible for the difference in cost. The fix is simple. Ask your pharmacist whether your current prescription is a brand name drug and whether a fully covered generic equivalent is available. In most cases, the generic is medically identical to the brand name version. Switching to the generic means your cost goes from something to nothing. The second strategy involves coordination of benefits, which matters if you also have a private or workplace retirement insurance plan. Under the new rules, the public provincial plan pays first. This is a fundamental change for many seniors who previously relied on private insurance as their primary drug coverage. Here is a practical example. If you previously paid a $5 copayment on your private insurance plan for insulin, that copayment should now be zero. BC Pharmacare, Manitoba Pharmacare, or PEI Pharmacare covers the first dollar, and your private plan may then cover any remaining costs on other medications not on the national list. To make this work smoothly, make sure your pharmacist has both your provincial health card and your private insurance information on file. The coordination should happen automatically at the pharmacy counter, but only if both pieces of information are in the system. The third strategy involves special authority, and this one is specifically important for BC seniors. Some medications on the National Pharmacare list are what the system calls unrestricted benefits. That means you can access them without any pre-approval. But other medications still require special authority, which means your doctor needs to submit documentation to BC Pharmacare confirming your diagnosis and clinical need. Here is a helpful update for 2026. As of March 1st of 2026, special authority is no longer required for empagliflozin, sold as Jardiance, or for gliclazide. If you were previously paying out of pocket for either of these medications because your special authority had lapsed or was never filed, you can now access them without that extra step. However, two related medications still require special authority. Linagliptin and saxagliptin still generally need special authority approval to be fully covered under Plan NP. If you take either of these, speak with your doctor to make sure the approval is current. Now let us cover the mistakes that could accidentally cost you money even in a system designed to be free. The first mistake is filling your prescription in the wrong province. National Pharmacare coverage is tied to your province of residence. If you are a BC senior visiting family in Ontario or spending a few months in Alberta and you fill your insulin prescription there, it will not be free. Ontario and Alberta have not yet signed the single-payer bilateral agreement with the federal government. Their provincial systems do not recognize Plan NP. You will pay the out-of-pocket cost as if the national program does not exist. The fix is straightforward. Before traveling within Canada, fill enough of your covered prescriptions in your home province to last the trip. Do not wait until you are running low and find yourself at a pharmacy in a non-participating province. The second mistake involves dispensing fees on your other medications. Here is a nuance that trips people up. Dispensing fees are covered by the National Pharmacare program, but only for the specific medications on the national list. If you take blood pressure medication, cholesterol medication, or any other drug that is not on the National Pharmacare formulary, the dispensing fee for those medications is not covered under Plan NP. You will still pay those fees unless you are also enrolled in a separate low-income provincial drug plan that covers them. This matters because some seniors assume that once they are enrolled in National Pharmacare, everything at the pharmacy becomes free. That is not the case. The zero-cost coverage applies specifically and only to medications on the approved national list. The third mistake is missing the device expansion in BC. Starting April 1st of 2026, continuous glucose monitors and insulin pumps are moving to fully universal coverage in BC. But this does not happen automatically for everyone. Your healthcare provider needs to have your records updated to reflect your device use. If your physician's records do not indicate that you use a CGM or an insulin pump, the coverage may not flow through automatically on April 1st. Contact your doctor's office in the final week of March 2026. Confirm your records are up to date. Ask specifically whether your device coverage has been transitioned to Plan NP. A 5-minute phone call could save you hundreds of dollars in out-of-pocket device costs. Let us now zoom out and look at the bigger picture. The 2026 rollouts in BC, Manitoba, and PEI are being watched closely as a proof of concept for the federal government's universal pharmacare vision. The Canadian Drug Agency is continuing to build the national formulary. Analysts expect the list of covered medications to expand in 2027. High-use categories like cardiovascular drugs and respiratory medications are frequently mentioned as the next likely additions. For seniors living in Ontario, Alberta, or Quebec, you are not yet covered under the national single-payer system. Those provinces have not yet signed bilateral agreements with the federal government. However, the successful rollouts in BC and the Atlantic provinces are creating political pressure. It is worth monitoring your provincial budget announcements closely over the next 12 to 18 months. The landscape could change. If you are in a non-participating province right now, you are not without options. Speak with your pharmacist about your current coverage under your provincial drug plan. Check whether your income qualifies you for enhanced coverage, and ensure that any private insurance you carry is being used to its full potential in the meantime. Let us close with the 3 most important actions to take right now. If you live in BC, confirm with your pharmacist that they have your MSP enrollment on file and that your insulin or other covered medications are being processed at zero cost. Then, before the end of March, contact your healthcare provider to make sure your device records are updated for the April 1st coverage expansion. If you live in Manitoba, ask your pharmacist to review your current prescriptions against the updated drug benefits formulary from March 1st of 2026. The bulletin update may have added coverage for medications that were not free under the original June 2025 rollout. If you live in PEI, confirm that your prescriptions are being filled at a participating community pharmacy. Also confirm that any blood glucose test strips you use are being processed at zero cost under the national program. And regardless of which participating province you live in, talk to your pharmacist about generic alternatives. If you are on a brand-name drug with a fully covered generic equivalent, switching could eliminate any remaining out-of-pocket cost entirely. Here's the final thought I want to leave you with. The cost of managing a chronic condition like diabetes has been a quiet financial burden on Canadian seniors for decades. People have stretched prescriptions, they have skipped doses, they have chosen between medication and groceries. That is the reality that this legislation is designed to address. Bill C-64 and the national Pharmacare rollout do not solve every problem. The GLP-1 exclusion is real. The geographic patchwork is frustrating. The rules around special authority and generic pricing require attention. But for a senior in BC, Manitoba, or PEI who is managing diabetes with insulin or metformin, 2026 represents a genuine and immediate improvement in retirement security. The system is more generous than it was last year. Your job is to make sure you are actually using what you are now entitled to receive. If this video helped you, make sure you subscribe so you catch our next video on the 2026 dental care plan for Canadian seniors. We will see you there.